The following video depicts the surgical treatment of a medial meniscus tear. The case is started by making a small poke hole incision in the front of the knee and introducing the arthroscope to the knee. The kneecap cartilage is visualized. In this case, we can see a small amount of wear and tear and cartilage fraying, which is then treated by smoothing with an arthroscopic shaver. Kneecap tracking is then assessed. The scope is then brought into the medial aspect of the knee. The medial compartment is inspected. The meniscus tear is identified. In this case, the patient has a fairly large flap tear of the back portion or posterior horn of the medial meniscus. A probe is carefully introduced through the portal. The probe is then used to identify the tear. An arthroscopic shaver is then brought in to remove the torn flap of meniscus. The shaver removes the torn, damaged portion of the meniscus while leaving as much healthy meniscus behind. The meniscus is then inspected. In this case, there is a rolled edge of the meniscus seen at the junction of the back portion of the meniscus with the middle. The probe is brought in to identify a large displaced flap tear component. This flap is reduced back into the joint where it's accessible. An arthroscopic biter is then used to trim the stalk attachment of the flap. An arthroscopic grasper is then utilized to remove the large meniscus flap. The shaver is then reintroduced to remove the debris and smooth the remaining portion of the meniscus. The meniscus biter again is used to trim a small remaining horizontal tear. Final smoothing of the meniscus is performed again with the arthroscopic shaver. Finally, the probe is used once again to check for any remaining tears. The instruments are then withdrawn and the case concluded.